I'm your host, Liana, and on today's episode, we are going to talk about something that is overlooked, misunderstood, but is very important: perimenopause and menopause. So, you might be wondering, Liana, isn't this topic for older women? But we, as women, all need to learn about our bodies so that at every stage of our life, we can thrive. So I'm here with the lovely Dr. Vidya Sharma, and she is a OBGYN in New York for 20 years. Thank you, Dr. Sharma, for coming on to my podcast.
Thank you for having me.
Yes, so we're going to dive right in. So, can you explain to us what is perimenopause, what is menopause, and at what age does a woman develop this?
Menopause means complete cessation of periods, like no periods for 1 full year. That is menopause. So let's say someone has did not get period for 9 months and then they get period. That's not menopause. So menopause means no period, not even a drop of blood for 1 full year. And before women go into menopause, their menstrual cycles become irregular. They get it every 2 months, 3 months, 6 months, 9 months. Most of the time, they're not heavy, and that is called as perimenopause. Once your period goes away completely, that is means you have gone into menopause, it should not come back because that's not normal. If your period has gone away and then it came back, that you need to see a doctor because something is not right. The average age of menopause is 51 in the United States. But
Yeah.
again, it varies a lot. It depends on a lot of factors, and the range is kind of like wide from 45 to 55.
Okay, that's very interesting, and that's great information to know. Also, what are some signs and some symptoms of getting into perimenopause? I know that's the initial stage of menopause.
A lot of times women will have symptoms like hot flushes. They would feel like something like a heat wave is going through their body from head to toe. Or some women also feel a lot of sweating. They sweat a lot. They have some anxiety symptoms whenever these hot flushes come. It usually lasts for like few minutes. Some women can get these almost 10 times in a day. Hot flushes is one of the very common symptoms of premenopause and menopause. And some women can get it up to 10 years, but average women, most of the time, it lasts for like 4 to 5 years, I would say. And it starts during perimenopause and it continues in menopause and it ends 1 or 2 years after menopause. So that's how the hot flashes are. There are other symptoms as well, like vaginal dryness. Some women complain of mood swings and lack of sleep. There are a lot of they experience a lot of sleep disturbances. Like that, the common symptoms. Some women also have like loss of sexual desire. Those are, I would say, more common symptoms of menopause and perimenopause.
That must be very difficult for a woman to go through those symptoms. And do they come all at once, or is it like a gradual?
Don't come all at once. Some women would experience all of them at like one time, or some women will get experience one after other. But in general, these all symptoms can last a couple of years. So perimenopause can last for a few years. It's not just a month or 2 month or 1 year. It because perimenopause is like few years before women actually go into menopause. So these symptoms are also going to last similar way, perimenopause, menopause.
How, as women, do we handle these symptoms and everything? How do we manage?
Right. So first is basically being aware about it. I think there is so hush hush, in general, women have never spoken about their problems and their health. And I am glad you're doing this because, we need to educate more and more women. So women are actually, even if they are suffering, they like take it, it's normal, assume it's normal. And they have been just suffering
In
silently. First and foremost is educating them that they don't have to suffer in silence. There are treatment options available, and there are variety of options available, not just one. So that is where we are, like educating and making them empowered for their own health, and of course asking doctors if they're experiencing these symptoms and going over the options.
No, I love that. Educating yourself, and making informed decisions for your body and for your life. When we talk about all these symptoms like hot flashes, mood swings, how would you cope with these mood swings? And I could also be very mentally tolling on a woman.
It is very mentally exhausting. And, like one, they're going through it silently. Nobody else understands it. And so they need to advocate for themselves. As I said, there are treatment options available. They need to like reach out to the doctor and say, hey, I'm experiencing all these symptoms. Again, there are some common strategies which women can try, but if it's not helping or if the symptoms are really bothersome, then definitely they need to ask their gynecologist because there are options available.
And you spoke about options available. What are some holistic options and what are some options? I know I've heard about the HRT as well. So can you explain some more
Mhm.
about that?
Sure. So, I mean, if we divide like non-medical options, like they can try simple things like avoiding alcohol, avoiding coffee, drinking like cold drinks. So that is helpful. Or keeping their temperature low because the hot flashes is like a symptom of like heat wave going through your body. So like drinking cold things, cool things, or layering of clothes in addition to like keeping your temperature low. So these are like common things you can try. Regarding the vaginal dryness, there are a lot of lubricants available over the counter. They can try those. There are also other things like exercise and all. They can try aerobic exercise. But if it's not helping, there is something called as hormone replacement therapy.
Mhm.
So which a doctor can prescribe, and there are like of course doctor has to go into your detailed medical history and see if you are eligible to get that, and if you are, you can get hormone replacement therapy. There are also non-hormonal medical options which can be given for women who are experiencing vasomotor symptoms or hot
Okay,
flashes.
that's great. Having a combination of a healthy diet. You can also try maybe some herbs, also some primrose. I've heard vitamins.
Yeah, a lot of women try like black cohosh,
Oh,
and there are some herbs women have been trying. Now, we don't have enough data on that because it's not FDA regulated and we don't know what all it contains. But women have been trying. Women do try herbs, women try some compounded medications. But FDA approved is mainly the hormone replacement therapy. That's the FDA approved. But there are herbal remedies women do try, and I'm not sure how much it is helpful. But the other modification which I mentioned about, like lifestyle changes and exercise, those have been
yes.
somewhat helpful.
Okay. And also for a woman, how does a woman's body change?
Weight gain is one of the common symptom in menopausal women. Regard also their bones get weaker, so they are once they go into menopause, they are more likely to have fractures or they can have heart attacks. Because of the hormones. Believe it or not, the hormone which we get from our ovaries, which makes us look pretty, it also has a lot of benefits. It
Yes.
basically it protects. Yeah, it gives you strength for your, it makes your bones stronger, it makes your heart stronger, and of course it makes our skin look good, and of course the brain also. So some women do complain that, oh, I tend to forget a lot, or some women do, even with a trivial fall they can get more fractures like wrist fractures or hip fractures. So they do need to be careful about that.
So I know we touched on mental health and going through mood swings and a lot of depression when you're going through this phase of your life. So I do believe that you should go to your therapist, have a community of other women that can help and support you through this journey. What are some communities or some resources that
Yeah, so definitely for mental health, definitely you should see their therapist or their psychiatrist because it can be very overwhelming. And if you already have underlying anxiety or depression, and then menopause can make it worse because all these lack of sleep and all these mood swings can make it worse. So definitely they should seek therapy or help whenever they need. And then regarding the resources, there are lots of resources. So one, there is like something called as NAMS, which is National Menopause Society, which
Okay.
is so women can go there and get some information that our governing bodies, which is ACOG is governing body for all OBGYN in the United States, and they have a lot of information on different conditions in women's life, whether it is menopause or even other conditions like pregnancy. So, and in common language, in common terms. So women can also go on ACOG website and also go to NAM's website, and there are a lot of important resources.
No, that's great that we have so many resources out there for women that want to seek some knowledge and some about their health and everything. And can you explain like the menstrual changes that a woman may experience during this time?
Yes. So basically, what happens, the menstrual cycle length is basically depends on a base like a follicle which comes out of the ovary, and then women ovulate, and that actually determines the menstrual cycle length. So as we get older, what happens is the number of the follicles go down in women's ovary, and also the quality of the follicles go down. So the all the good follicles are already like they have already been ovulated, and that's why when as we get older it's harder to get pregnant because the quality of the follicles go down, the quality of egg, I mean, so that goes down too. As I was saying, the quality goes down, the number goes down, so the menstrual cycle gets affected. So
Yeah.
menstrual cycle starts becoming longer. If they are getting their period, if they were getting their period every month, they start skipping periods. Like they would not see it some month, they would see it some month. Sometimes some women can also have heavy periods. Now,
Mm.
heavy periods could be because of the menopausal transition, but sometimes there are other conditions like fibroids or other medical conditions like adenomyosis that can also cause heavy menstrual cycle. So they definitely need to see their doctor and make sure there is nothing else going on. Then they shouldn't just assume that, oh, menopause is causing my periods heavy. But so as I was saying, this is one of the symptoms of perimenopause and menopause. Menstrual cycles become heavy, they become irregular. Sometimes they may not be heavy, they may be very light. They're just skipping. They're very like all over the place. Women will say, "Oh, I don't know when I'm gonna get my period, like I don't know when my period is gonna come down." So they become irregular. And this can last for a couple years, and then the menstrual cycle completely goes away. That means the ovaries have basically stopped ovulating, ovary is not, the hormones are gone really down, and that is why a menopause occurs, and then there are no periods at all for 1 year.
Okay, no, I love that you touched on that each woman is so different and that you need to seek your OBGYN to get checked. It might be something else, maybe fibroids, maybe cervical cancer. So really go and get it checked. Yes, I know during this stage, menopause can affect your intimacy, your sexual drive, and your libido. So what advice do you give to women uh that feel that way?
Yeah. So again, as I was saying earlier, that women don't talk much about their problems, right? And this is one of the problem women experience, and because they're experiencing vaginal dryness, they're also already having some mood swings and sleep disturbances, and of course, in addition to that, their sexual desire goes down. So again, spending more time in foreplay is important. There are treatments available for even vaginal dryness. They can use over-the-counter lubricants, which are available. Or if they want to use the hormones, we can also provide hormones which are given like only in the vagina, like vaginally. So they don't have to take any pills or any patch. Like hormone replacement therapy, there are different medication. You take a pill, or you take a patch, or you can use a ring. But if you don't want that, then you can just use vaginal supplementation for hormones, and that would help you for vaginal dryness. Now, it is not forever, it is given for a limited period, but it definitely helps with the vaginal dryness. And of course, there are some newer medications which also the doctors can prescribe. However, you do need to see your gynecologist and see if you're eligible for those, because they also have some side effects and there are some contraindication for those medications. Spending more time with your partner and foreplay. And of course, the sex therapy is also an option if women want to pursue this more.
You touched on that, going to having all these different options. I know we talked about hormone replacement therapy, HRT. So, what are some risks that could be involved in it?
Hormone replacement therapy is given different ways. There are like estrogen, and there like hormones are given. Estrogen and progesterone are the hormones mainly involved in the hormone replacement therapy. Now, they because it's a hormone and we are giving it from outside, they do have some side effects, right? That is why you need to see your gynecologist and make sure you're eligible to get those. But if you have a uterus and you are just being given only estrogen and not progesterone, you can develop cancer of the uterus. So that
Okay.
is why we do need to protect your uterus by giving you progesterone. And we also need to give you, sometimes we can put an IUD in your uterus so your uterus is protected. Okay. Now, there are other side effects like increased risk of stroke or increased risk of blood clots. So that
Okay.
is why if someone already had those before, those women will not be able to get them because hormone replacement therapy can increase your risk of all these blood clots in your legs or in your lungs. So that is one of the uh, big side effects. Fortunately, it's very rare, though. That is one fortunate thing. Studies have been very controversial regarding the risk of hormone replacement therapy and the breast cancer. There was a big randomized control trial which was done in, I would say, 1990s, and which is called as WHI trial, and it showed that women are at increased risk of breast cancer, and I mean it was a very big trial, and then the trial had to be stopped in the middle. But subsequent data showed that hormone replacement therapy, it depends how it is given. If you're giving both hormone, it really doesn't increase. If you're only giving estrogen, and so they found like different result from before. So the studies are actually conflicting regarding the breast cancer risk. But if you are healthy and you have no medical problem, replacement therapy is a reasonable option. Again, we give it very small dose and we give it very short period. It's not that you're going to give it for the rest of your life because now you don't have your hormones. We don't give it. It's given for shortest period. It's given in a smallest dose. And again, it is given only if you're experiencing these hot flushes that or sleep disturbances or everything is like so bothersome that it's affecting your daily life. So that is when we give hormone replacement therapy.
Okay, because I know someone that is taking the HRT and they actually really love it because it really helps their symptoms with the hot flashes and stuff like that. So that is a good candidate that if it's taking over your life, that's the alternative.
Many women did not know about it, or as I said, women have been just ignoring their health or have been suffering in silence. So we really need to educate our women about their bodies, and till they know what is happening, they can't advocate for themselves.
Exactly. And now that we're speaking on these topics, we're informing the woman, we're educating them on these different methods, and you have options. You have all of these resources and information to your fingertips. Now it's your choice to make the best choice for your body. But I love this that we're having these amazing, empowering conversations.
We need this, and our women need this.
Begin and changes in a body during menopause. So, do you have any tips on maintaining a healthy body during this time menopause and getting older, weight gain and
The exercise is always helpful and is always needed. US Task Force, like a medical association, everyone basically recommend that everyone should do moderate intensity exercise at least 30 minutes a day and 5 times or 5 times a week, at least 5 times a week. So which is comes to 150 minutes, which is very helpful for a lot of reasons, right? For your mental health, for your heart health, for your bone health, for your body in general. Now, regarding these hot flashes, so we call them vasomotor symptoms in the medical language. So these hot flashes, aerobic exercise did not show much benefit. Regardless, the exercise is still helpful. So yes, women should continue doing exercise, or if they were not doing it, they should start doing exercise. Also, like eating diet rich in calcium, like dairy, it's because your bones are getting weaker, right? So you can eat more dairy products like yogurt and dairy milk products, which are rich in calcium. That is helpful. And of course, and cut down on your alcohol because alcohol has a lot of, it also contributes towards weight gain. So yes, cutting down of alcohol and caffeine, because caffeine can cause urinary problems, and also it worsens the hot flushes. So cutting down on those things, that is helpful. And make sure you get your regular health screening, right? Get your regular mammogram, regular pap smear, regular colonoscopy. Make sure you get all that done. So those preventive care is equally important. Now, regarding the bone health, we check women's bones to see how strong they are. They need any medication. There are medications we can give for if their bones are getting weaker, or if they are more risk of getting fracture. But usually we start that test for that is at 65. If we can do it even earlier if women have risk factors. Somebody is like a chronic smoker, so in those women we would start it in early age. We won't wait till 65, but we can do the test to see if your bones are really getting fragile and if you need medication to make them stronger.
Having a healthy diet and with exercise as well is really good to have a balanced lifestyle and implementing exercise every day, maybe like a cardio, having a little bit of weights into your fitness routine is really good as well.
That is so true, right? Weight-bearing exercises, like adding that once or twice a week, that is helpful because we lose a lot of muscle mass as we get older. So that is definitely helpful with the weight-bearing exercises.
So yogurt, soy milk, oat milk, all these are great foods that we have that you can implement into your diet. What do you think? Also nuts. I've heard like having also intaking nuts as well.
So, I mean, nuts is a good source of protein. So the diet, yeah. So people who can't eat other sources of proteins like meat and all, so nuts is good for that. Nuts also have some fat, so that's why you have to be careful. But nuts are good source of protein, and definitely increasing your fiber consumption, because as we get older, our metabolism slows down.
Yeah.
So our bowels slow down, so the food kind of sits in the stomach. So yeah, cutting down on the carbs and increasing more fiber consumption is helpful for your bowels.
Okay.
And it helps you with improving your constipation. So increasing more fiber in your diet is very helpful. Not necessarily help with your hot flashes and all, but in general, those are healthy habits, and we really need to implement them because as we get older, we are also at risk of other diseases like diabetes and hypertension.
Yes. Having an overall healthy lifestyle is going to really help you as you get older so that it is not as drastic or as overwhelming the symptoms. So, Dr. Vidya, how can a woman at this stage embrace this stage of her life and know that this is a transition that is empowering rather than something that is negative?
Lovely. Yeah. There is so much stigmatization about aging in general, I feel, and stigmatization about menopause. There's so much hush hush about a
I
lot of
know.
things. I think one women are more educated and they know that it's natural, it's normal, and all these symptoms they're experiencing is normal. They would be more willing to accept it. When more people around women are aware about it, they would be willing to help or
Yes.
understand, So, like through these situations, like through these resources, like podcasts you're doing, or other women or other people are doing these podcasts, and of course, as I mentioned, the resources women can use and share with their family members, and they can advocate for themselves, and that is how I think women are going to accept it and age gracefully
Yes.
rather than feeling bad about it, that we all have to age
It's a blessing to reach a certain age.
as long as they are more empowered and they understand what is going on, they would be more willing to accept and advocate.
I totally agree. I believe that with age, you would hope that you come with a lot of wisdom. Yes.
Emotional maturity, wisdom,
And with that
that
confidence in yourself too, knowing who you are as a woman too. I believe that age should not be this stigma of like this negative connotation with it, but celebrated and having that support system you said, and these resources and tapping into these forums and these articles and these podcasts and even YouTube videos on women's health and learning about, all these from cervical cancer to menopause to your menstrual cycle is so important as a woman because this affects not just us, but our family life. Like if we can't function as a woman, our day to day, then, we are so much, we're just like a foundation of our family, and we're like a really important key to our family. So as a woman, if you need to take care of yourself and put yourself first.
Benefit from it. Totally,
Yes,
very well said. If we are suffering and if we are not happy and we are experiencing all these symptoms, how can we make others happy? And of
exactly.
course, they're all going to suffer.
Mhm.
And everything is connected, right? The
Yes.
mind, body, soul is all connected. So if you are having all these mood swings, and people are going to say, hey, she's so crazy. Well, she's not
Hmm.
crazy. She's experiencing these symptoms. And
Yes.
if she knows what is happening and she takes therapy or treatment or whatever she needs, and more people can understand her or can advocate for her, so definitely there would be world would be so much better, right?
Yes, I
We all,
agree.
yeah.
Yes. So, what is one piece of advice you would give women about, going through these changes with their body and just their health?
So, kind of tricky question. It's hard for me to give one piece of advice,
Yes.
but but I think what one I definitely like the fact that you're what you're doing and will reach out to many women and they can help propagate this more and more women would understand. So yes, I have to give one piece of advice, I think I would tell women to advocate for their own mental, physical, emotional well being. If
Yes.
we only don't advocate, then how are others gonna take care of us? We
Yeah.
have to ask what we need. So you are not alone in this journey.
Mhm.
Reach out, ask your family members, your gynecologist, your doctor, but you have to advocate for yourself. And
Yes.
there are a lot of information, there are a lot of options, treatment options, there are a lot of resources available to help you. But one I would say is just learn to advocate for yourself.
Yes, don't be ashamed. We all go through it as women. So, yes, advocating for yourself is so important. Asking the doctor the right questions, doing your research. Yes.
There is no need to be embarrassed, and there is
Mhm.
so much available. And again, as you said, right, aging gracefully, and there is so much which
I
comes
love
with
that.
aging, getting older. So, yeah, we all need to age gracefully.
Yes. So, thank you so
Okay.
much for being on my podcast.